Good evening, guys. Excuse the way I look. I just got out of the shower, but I thought I'd do a discussion for you tonight. Discusses MAD, which is medical aid in dying. Now, this is legal in 10 states, so I'm going to discuss it for you all tonight. Okay, MAD is a practice which is medical aid in dying. Like I said, the acronym is MAD for short. Is a practice that allows terminally ill individuals to choose to end their lives with assistance of prescribed medication. This practice is currently legal in 10 states and Washington, D.C. in the United States. MAD is different from euthanasia, as the patient must self-administer the medication, whereas euthanasia involves a doctor administering a lethal injection, which is legal in the U.S. This process requires the patient to have a prognosis of 6 months or less to live, be of sound mind, and be able to self administer the medication. The practice is supported by many as it provides a sense of control and dignity to those facing terminal illnesses. However, it is also subject to controversy, with opponents raising concerns about potential uh, potential consertion and the ethical implications of assisted death. Okay. Now you got the bottom piece here, which if you want to learn more about this topic, you can check the full article out at msn.com, folks. It's there. But like I said, it's legal in 10 states. Um, if a person has an illness that is going to kill them, and they have a short life expectancy because of this, because of the illness, and it renders them. Let's say the illness renders them unable to do things for themselves, or if the illness makes them suffer a lot. People have to take those things into consideration: the illness, the fact that it may change your life. It may, the illness may be one that hangs on forever, like for instance, MS or multiple MS or MD, muscular dystrophy, um, or for that matter of fact, Lou Gehrig's disease. Those, if someone comes down with one of those illnesses, it's like they're still there as a human being, but their body becomes like they're unable to use their body. So those kind of folks, they feel like they're in a sense in jail because they can't use their bodies. Um, they don't, if it's a regular person that comes down with MS or Lou Gehrig's disease or um, something of that nature. If they become disabled, some of those folks don't know how to handle being disabled in the first place, and having a terminal illness on top of it that you can't that you can't that you can't treat, or it doesn't get any better. Um, you know, providing they live in one of the states it's legal. Like I said, it's like it has like 10 states. So I mean, my thoughts are, if you're suffering from a terminal illness, and you know, you want dignity with what's going on. um my first my first my first start would be hospice care. um you know, those folks will be able, you know, to help a person with that. Hospice is legal. You know, hospice takes care of any illness that's terminal. Doesn't have to be just cancer, can be different ones also. um to me, hospice gives a person dignity. um like, I've seen some people tell me, I want to go to sleep, and in their sleep they pass without any pain. That's your goal, to see somebody without any pain. um I because I because I'm certified in hospice care, I take that certification very seriously when I do somebody's care. Like I said before, I do their care down to the T, exactly how they have it written. But the key thing is you have to have it written to your specifications. Now, like I said in other a few minutes ago, there are 10 states where mad is legal. 10 states, folks. Um, Now, if if it's like I said, if it changes a person's life, if it makes them become unable to control their own body movements and things, some people uh, some people are, you know, embarrassed about having somebody come in and help them, because they've lost use of their bodies in some sorts, you know, leg, arm, stroke, you know, because of a stroke maybe, or um, because of an accident, or in the case of somebody I know, he this person became disabled after being an able body for a long time, for years. A choice he made to go uh, riding four wheelers and ATVs. He rolled his ATV, and now he's paralyzed. So you never know. You never know what kind of situation you get, and you never know how a person's gonna handle that. But like I said, for tonight's show, this is important to me, so I decided to do a series on it. Um, MAD is for those people who are unable to come back from illness. Those it is for people that are going to pass from their illness. It is for them to decide if they can, um, you know, it is, like I said, it's only in it's only in 10 states. But it's something that I think people have to have a conversation about, because it really matters. If someone has a illness that's going to render them helpless, dependent on somebody, or bedridden, um, if someone has that choice, it's their choice to make. But my suggestion to somebody that is going through that is, seek hospice care first. Because first of all, you have to go through and find one of the 10 states that offers it. And that's a hard thing to do, because there's only a few. There's only a few states that offer MAD. Like I said, person has to be of sound mind when they make this choice. Like I said, they have to weigh what comes up. They have to make sure that they do the research about their illness first. See what happens first. Check it out. When people get diagnosed with certain illnesses, I'm sure that people do a lot of research because of it, because they want to know what's coming. They want to know, they want to figure out how they're going to prepare for a terminal illness. Because when somebody first finds out they have one, it's a scary thing. It's a scary process. Like, I've had friends who've had, like I said earlier, I've had friends who've had cancer before. And because of a reaction, one of them is dead. Because of something that the hospital gave her. She had a reaction that killed her from the reaction, not from the cancer, from the reaction. So, I mean, having the choice of going, if you, like I said, if you know that your illness is going to get worse and that you're going to lose the ability to do something, then that's another whole ball game for people to figure out. But the person who has the illness has to figure that one out. Nobody else can do that for them. They have to figure it out. With that being said, Gator Wellness, have a good night, folks. I thought this was important for me to do a show for. So I hope this helps somebody, with this situation. Until tomorrow, Gator Wellness, have a good night, folks.